Blog Talk Radio.
Welcome to Medicaid Matters, the only live talk show about the business of Medicaid health care. And now, here's the host of Medicaid Matters, Richard Yaden.
And thank you, Braley. Today, we're going to be talking about one Medicaid health plan's mission to transform care management. You're going to hear about some ideas that are innovative, that are practical and effective. And of course, that's what we do here every other week on Medicaid Matters. Welcome, everyone. And to those of you listening in, either at the Blog Talk Radio channel, watching us or listening to us on iTunes, or one of our growing list of distribution partners, or even watching us live on MedicaidTalk.com, we're glad you're here. Today is Tuesday, June 26, 2012, and I'm your host, Richard Yaden, President of Managed Medicaid Services, and also the continuing host and one of the lead sponsors of the Medicaid Matters talk show. Well, I was almost certain today that we were going to be talking about the Supreme Court's decision on this show, but it looks like we're going to have to wait until Thursday until we hear what they have to say. Now, you can go to MedicaidTalk.com, go through our past shows, and you'll find one that we did back in, I think it was in April. It was shortly after the hearings about the future of Medicaid, and we looked at several scenarios of what might happen depending on how the Supreme Court could rule one way or the other. During that show, I spoke with several policy consultants, with several Medicaid experts about that topic. It's actually become one of our most watched and one of our most downloaded shows that we've done throughout our first year here. So you might want to check it out and just get a glimpse of what we might start to see here in the future, and at least have some idea, depending upon which way the opinion goes, of which way Medicaid might go. And certainly in whatever direction Medicaid health care takes from this point forward, care management and care coordination are going to play a very central and very important role. And this is especially true as Medicaid health plans, as state agencies, as providers begin to grapple with the projected expansion of the Medicaid population. And in just a few minutes, we're going to hear from Karen Dale, Executive Vice President at DC Chartered Health Plan, about some of the innovative and unique approaches that they're implementing in their care management program. And since we are live, you, our listeners, and our viewers, you can also join us in this questions and answer period with your questions, with your comments or thoughts, or maybe some innovative approach that touches on one of our topics that you'd like to share. The phone lines are open now. You can call us at 626-657-2125. That's 626-657-2125. You can speak with me or with Karen, and we would really like to hear your opinions, your comments about our subject. If you can't call and you happen to be on Twitter, well, you can send us a comment or a question through there. Just send it to our Twitter handle, which is at Medicaid Talk, and we'll get them on the air as time permits. And finally, if either of those methods don't work, you can join us in a live chat that is going on right now on the MedicaidTalk.com webpage. Just go there, and we'll read your comments and your questions on the air as we get time and as we move to that appropriate subject. Well, transforming Medicaid care management, that's our subject today. And we get to hear from Karen Dale, someone who is doing just that. Karen is the Executive Vice President of Strategic Health Solutions at DC Chartered Health Plan. She is responsible for generating and leading the key initiatives and support future growth of the organization. Not an easy task. She's a leader in their strategically aligned business planning and innovative solutions for services. She's also charged with creating unique ways to solve the critical challenges relating to their members. Currently serving over 100,000 residents, Chartered is the largest Medicaid MCO in the District of Columbia. And Karen, I want to say welcome to Medicaid Matters.
Thank you so much for having me this afternoon.
Well, before we jump into the subject of care management, were you as surprised as I was that we didn't hear anything yesterday from the Supreme Court?
Not exactly. I think there's a lot of deliberation going on, and I want them to take their time and weigh everything and hopefully come out with the best decision.
Yeah, it's an incredibly monumental decision, one way or the other. No question about it. And I think you're right. It's going to have some very careful consideration. It would be nice if we knew what it was, because I think it would be interesting to our listeners and our viewers what your organization would do with the ruling, but we don't know, so we're just going to have to wait in suspense for a few more days, I guess.
Yes, indeed.
Now, have you always been working in Medicaid healthcare and care management?
No, the bulk of my career has been in managed care, and I've specifically been in Medicaid managed care for about a decade. I've had some other interesting work that I've done, for example, working for a large service organization, not-for-profit, and those other things that I've done really have just strengthened my resolve and my passion around the population that is often most in need in terms of public benefit and services.
Yeah, no question about it. Well, tell us a little about some of the prevalent challenges that you are currently attacking at DC Chartered Health Plan.
The main things that, if I were to give you a headline, would be the root causes of gaps in care. Where our members are struggling to stay well or cope with a chronic disease, we feel as though that's really what we have the ability to address and solve. And so whether it's the person that might have a gap in care because they just had an inpatient stay and they don't fully understand their discharge plan, or they haven't followed up and made an appointment to go back to see their primary care provider, and that creates a gap in care, or it's the member that is having difficulty navigating the health system because they have several chronic diseases and trying to keep up with all the appointments and the treatment plans is difficult for them, or the person that might be utilizing the emergency room because there are some psychosocial issues that make it so that that's an easier access point for them. All of those persons, for different reasons, are likely to have a gap in care, and we want to work through solutions that are unique to that member and their psychosocial circumstances. We want to acknowledge any behavioral issues and really treat the whole person by addressing the best way to help them navigate and get to wellness and positive health outcomes.
Well, that is certainly a full plate. I mean, how do you prioritize what you can attack at any given time?
We start with where the member is at that time. So we have the ability, starting off with every new member, to do a health risk assessment. And that health risk assessment helps us to understand where the member is in terms of disease states or behavioral or psychosocial issues. And based on that assessment and wherever else it might lead us, what's going on with that member, all of that is where we begin our care management process. So we prioritize based on the issues. So if the person has food instability or housing crises, expecting that they're going to be focused on going to pick up their medications or making an appointment it makes it a little less likely that's going to be their priority that day. So we work very hard to understand from the member, where are you right now and what are those factors or barriers preventing you from doing what you need to do for your health. And whatever those are, we engage fully our community partners. We have social workers on staff that are well equipped to help. We make the appropriate referrals for behavioral health so that we position that member best to address their health care needs. We've got to get those other things out of the way first because it's just less likely that the member, unless they're in a medical crisis, will then focus on those other issues.
That's a good point. I remember talking a few months ago with a MCO CEO, and he was saying, how can I get people compliant to go get their prescription filled if they're worried about getting the refrigerator filled? And that's a very real issue. It's a very real issue. Well, let's jump into the area of care management. When you and I were talking last week, you were telling me about your pillars of transforming care management. Could you explain to our audience what you mean by that?
Sure. Our pillars it's always helpful to have a clear way of organizing your approaches and your work. So for our team, we spent some time talking through what did we want to be different and what would success look like. And as a result of those deep conversations, we determined that there were 4 pillars on which we rested our health focus in terms of care management. So the pillars are, first, data mining, so that we can proactively identify where interventions are needed. I mean, Chartered has been in business for 25 years, so we have a lot of information that can help us to do some predictive work, as well as we have sophisticated enough systems that we can really look at what's going on at member level detail. We can group that information and make some assumptions and take some specific action. So a key piece is around data mining. A second pillar is achieving a high level of member and provider engagement, and I'll talk more about those a little bit later. The third is collaboration with stakeholders and community-based organizations. We do not expect that we can do everything, but we can certainly help to coordinate and communicate in a way that helps to build a robust team that can focus on these barriers or the potential barriers that a member might experience on their journey to getting well. And then the final is really about having enterprise-wide strategies so that within our organization, getting rid of the silos so that we're focused together on the right types of strategies and innovations to give measurable results. So yes, we want to do these interesting things and bring people together, but we're going to measure. We need to know that we've moved the needle in some way towards the positive.
Oh, in the area of the enterprise-wide strategy, we just have a few minutes before our first break here, but could you explain a little bit about how that is integrated throughout the entire organization? Because I know a lot of companies, particularly those that have been in business for a while, trying to implement a strategic process or a strategic vision across the entire enterprise. That has its own challenges in and of itself.
Sure. So one of the things that most Medicaid MCOs are dealing with is HEDIS, for example, making sure that each year you have a way of organizing across the organization to achieve your HEDIS goals. And one way to do that is to have HEDIS and that the goals of achieving or exceeding our HEDIS targets rest in every area of the organization. So not just in care management, but in terms of our member services staff. When they realize that there's a gap in care and a member is calling in, that's a great time to just give them a reminder, or maybe even a gap in care doesn't exist right now, but this person, maybe it's a woman calling in who needs to go for her mammogram in the next 3 months, but she's calling in because she wants to change her primary care provider. Great opportunity to just do a little education and give a reminder at that same time that you need to get your mammogram scheduled. You can certainly call back and get assistance from us in scheduling that. Or if you'd like, we can send you a mail reminder. But making every touch count. We use a vendor that does our after-hours phone coverage and clinical triage. And having them become part of our partnership in saying when a member calls and we know that they are due for some preventive screening or coming due, can you also deliver that message? And working with a number of our high-volume providers in the same regard, we have done a lot of work from an IT perspective to better support us to meet or exceed our measures in terms of putting together real-time data on where a gap exists or is coming due. So that's a great example of how we've connected internally to make every touch count to support members around prevention and wellness from a HEDIS perspective.
That's a very comprehensive approach, and I suppose is that part of your overall responsibility, is guiding that through the entire organization?
Yes.
Okay. Well, I appreciate that explanation. I know a lot of our viewers oftentimes will struggle with, how do I implement something long-term, strategic across the entire organization, and it's great that DC Chartered has located that or centralized that under your command. So glad to hear it. Well, we're going to stop here just for a few minutes for a message from our sponsor. When we come back, we're going to talk more about the pillars that Karen was describing. We're going to talk about member engagement, provider engagement, and other things. So you'll want to stay with us, and we'll be back in just a few minutes, and we'll talk more with Karen Dale, DC Charter Health Plan.
Nurses who want to stay on top of their skills know that the Nursing Informatics Learning Center is the place to go. You'll find articles, tutorials, a blog, e-zine, board-approved CE credits, links, assessments, and consultant services, all available to the global nursing community in one place. If you're a nurse or if your organization employs nurses, you need to visit the Nursing Informatics Learning Center.
By providing access to the care they need and the quality they deserve, Medicaid health plans enhance health outcomes of our nation's underserved. Listen to this letter to a Medicaid health plan that helped save the life of Juan, a 4-year-old with a rare heart disease.
All of your efforts have created a miracle for my son. Even though he was so close to death, you helped. You made a difference. Now he's coming along, little by little, step by step.
Medicaid Health Plans of America, ensuring access to better health care. Learn more at mhpa.org.
Elevating the quality of care with less cost. Today, that's the job of every Medicaid managed care company, but it can't be business as usual. Companies have to coordinate care a different way. The solution is Managed Medicaid Services. Through our virtual case manager network, our teams of Medicaid assessment specialists, and our new Advanced Care Transitions program, companies can dramatically raise the quality of care without increasing their cost. Visit us today at MedicaidServices.net. Managed Medicaid Services, your best source for innovative care management.
And welcome back to Medicaid Matters. This is the only live and interactive talk show about the business of Medicaid health care. Hey, wouldn't it be great if your clients and employees could listen to Medicaid Matters right from your company's website? It would certainly promote your brand as a leader in the Medicaid health industry, drive traffic to your site, and demonstrate your commitment to innovation in healthcare. If you'd like more information about how to do this, just email us at info@medicaidservices.net. That's info@medicaidservices.net. We'll send you information about how easy, free it is to have your website visitors go to you for the most up-to-date information about Medicaid healthcare. If you're on the MedicaidTalk.com page right now watching the show, go ahead and send us a message now. We'll be happy to give you the details on all of that. In 2 weeks, we're going to be talking with Michael Richards, Executive Director of Government Relations and External Affairs at Gunderson Lutheran Health Systems. We're going to be talking with Michael about advanced directives. Certainly a topic that needs to be talked about. I don't think we hear as much about it as we would like, but it's going to be a very interesting show. But today, we are learning how one organization is focusing on solutions and changing paradigms by transforming Medicaid care management. With me is Karen Dale, Executive Vice President at DC Chartered Health Plans. Karen, before we went to the break, we were talking about the pillars that you have created to kind of describe the way you're transforming. Let's talk about one of those pillars, and that's member engagement. Tell us what's happening or maybe not happening that led you to focus more on member engagement.
We had a recognition that there are a number of psychosocial factors that impact our success when we attempt to reach members by phone or by mail. And it's so critical that we are able to reach members in a timely fashion. And so we had to go back to the drawing board and say, what else can we do? What innovations can we put in place? Recognizing that it's not one size fits all, so we have to have a robust toolbox of interventions that we can use, because it's just absolutely critical that we're able to reach out to members in a timely way, as close as possible to the timing of what it is they may need. And so that really prompted us to do some hard work and some deep thinking about what interventions we needed to put in place to better engage our members.
Could you maybe dig in just a little bit more into what those specific psychosocial factors are that were kind of driving you in this direction?
A couple of them are, many of our members don't have a landline, so they rely on a mobile phone, and even having a mobile phone may not be enough. They may not have the financial stability to have an actual account, so they're using a pay-as-you-go phone, and at certain times of the month, that phone, they may not have the money to put money on that phone, and so it's very difficult to reach them during those times. Some of our members have housing instability, which means they're staying one place at one point and another place at another. Our Alliance population often has persons who are homeless, and so we're trying to reach them at a shelter, but they may not always be at the same shelter. So things like that make it difficult for us to always know where members are and how best to reach them.
What are some of the new initiatives that you're implementing to increase your member engagement?
I'll share with you two. One is more focused on technology and the other is not, but it gives you a sense of the breadth of the things that we think are important to have in the toolbox. Last October, we launched Positive Pathways. We did this in partnership with Common Health Actions Institute for Public Health Innovation and the Washington AIDS Partnership, two well-respected community organizations who brought a wealth of expertise to this initiative. The Positive Pathway program focuses on assisting HIV-positive persons living in wards 5 through 8, which is maps very closely to where we have some of our highest membership in the district. And what we aim to do in this program, it focuses primarily on women and their partners, because in the district we do have an alarming trend of more women, particularly women of color, representing the new HIV cases. So this program trains community health workers who were trained at the University of the District of Columbia in a specific program that helps them to understand health. So these are not nurses or social workers. These are peers, and we refer to them as peers because they are from the communities that we intend to serve. And the community workers are then trained so that they have enough of an understanding about a helping model, a supporting model of working with members. And then they also received some disease-specific training around HIV. And in helping them to do this, we started off with one community health worker co-located here at Chartered, and then we were able to get a second one. Both of these community health workers go out 2 days a week into the community to meet members wherever they are and would like to be met. They spend the other time in the office calling members who have a gap in care, where we have a lab result that shows that the member has been diagnosed as being HIV positive, but we don't have any claims that show that they have actually had any provider visits. So that's the group, that's the target population. So when a member accepts and says, yes, I'd like to meet with you, they go out and have a conversation with the member. And it's really about hearing from the member what are their concerns, what's going on with them emotionally in terms of having received the diagnosis, helping with any basic health literacy if they don't understand. We are fortunate that one of our community health workers is HIV positive, so when a member has specific emotional barriers that they're trying to get past, she is just wonderful at having the conversation about how difficult it can be when you first find out that you're HIV positive. How do you talk to your family members or your partner about it? And so it's just being there to be a very supportive person to help the HIV positive person navigate. They will go with the member to doctor's appointments. They will sit with them if they want them there to when they tell their family. It's just to give the member that unique relationship and someone who's there to support them in every way in terms of what needs to happen next to get them engaged in care. And we've just had some really great stories that have come out from some of these visits where they've been with a member, as they disclose to their family. They've gone with members who needed to get enrolled in a substance abuse program, which sometimes can be very difficult, that journey from when you've made a decision to go to get substance abuse treatment and then you actually go and show up. You can sometimes get diverted, which our members do when they're not fully in recovery yet. And so they will go with them to that appointment and get them signed in and just provide all that support that helps them to get to where they need to be in terms of their health.
One of our viewers is on our chat line has asked a question. This is from Rebecca. How many people do you have working in the community right now?
Specifically on the Positive Pathways program, it's 2 community health workers. Overall, in terms of our strategy, we now have 4 of our outreach workers who are embedded at one of our high-volume providers. Over 40,000 of our members are with one of the federally qualified health centers in the district, and we've got 4 community health workers out at their sites, and we also have a 5th one who is at another high-volume provider site. And it's part of our overall engagement model that we are going to be moving out more into the community and placing our staff at various sites so that rather than sitting in the building, placing calls, they will be out there interacting face-to-face with our members and providers.
And what is the ratio between a community health worker and members? Do you have a set model for that?
We do not. We have over 1,000 persons in the HIV, the Positive Pathway program that we had identified as having a potential gap in care, and we have 2 community health workers. We have other outreach staff and care management staff who, do outreach as well. But for this pilot, we've specifically focused on the community health worker model being that different approach to care management.
What are some of the results you're seeing from this?
All the persons who have been enrolled in the Positive Pathways program have gotten into treatment. They are keeping their visits. We are tracking their medication adherence, and so far, so good in terms of them following through on the treatment plan as outlined. Now, not everyone that we've approached has wanted to be in the program, and again, it's not the easiest diagnosis for people to accept and get past that acceptance in a way that allows for them to next take the appropriate actions for them. And so we understand that, and so if someone isn't ready at the time we approach them, then we can always come back to them again, because it's so important that this is about the member. It's not about us pushing and forcing. So we use things like motivational interviewing and, just very supportive measures to help the member to get to that point of acceptance in such a way that it leads to them taking positive and empowering steps to improve their health.
So you've had your two community health workers in the Pathways program. They have moved these 1,000 people in the program into a higher state of compliance with their treatment program and medication and things of that nature. Is that where you're going?
Yes. Now
okay.
we haven't touched all 1,000. That's
okay.
the journey. Yeah, that's the number we're working on. And so we've done outreach to at least 300, 400 of the members, and about half of those agreed to be in the program and are receiving active support.
And have you reached the other 500 and they just didn't want to be a part of it, or are you still working in that direction?
We're still working in that direction, and that takes us back to one of the questions that we talked about at the beginning of the show, which is the difficulty reaching members. I mean,
Yes.
There's a good 60% of our members that when you try to call them or send them mail, we don't, it's hard to figure out exactly where they are. But sometimes that depends on the time of the month. You may call them the beginning of the month and not available, but you try again at the end, or you try a different time of day, and then you do reach them. So we continue to make our outreach attempts in a number of ways until we feel like we've exhausted all possibilities.
And that's just one of the two member engagement programs that you're working with right now, correct?
Yes.
Okay.
So that's the non-technology one. The one that involves technology is our diabetes self-management cell phone project, and we began that one in March of this year. And here the intervention is around member engagement.
All right, Karen, we're going to have to come back to that because we're going to have to go to break right now, but we'll come back to that when we get back in just a second.
Sure.
Medicaid Matters is now booking guests. Who are we looking for? We're looking for people who can bring a fresh and unique perspective to the business of Medicaid health care. Do you have an idea that is unique, innovative, maybe even controversial? We want to hear from you. Go to MedicaidTalk.com, complete our guest questionnaire, and we'll be in touch with you to schedule an upcoming episode. Be a part of Medicaid Talk.
The Medicaid landscape is changing fast, and that means challenges, but it also means opportunity. Opportunity for you. And that's why you need to visit MedicaidJobs.net. MedicaidJobs.net is the place to showcase your talent to Medicaid companies, search for jobs, research the latest career trends, and register for the free Career Optimizer service. Don't wait. Go to MedicaidJobs.net today.
You're listening to Medicaid Matters on the blogtalkradio.com network.
Well, last month, more than 1,000 listeners joined our audience on Medicaid Matters. From Medicaid MCOs to government agencies to providers, our audience represents the leaders at the edge of Medicaid innovation and practice. You can bring your company's message to this Medicaid business audience by being a sponsor of the Medicaid Matters Talk Show. Email us at info@medicaidservices.net to get more information about joining the Medicaid Talk community. Well, I want to ask our audience, are you going to be in Boston this August? Medicaid Matters will be broadcasting live from the Medicaid Enterprise Systems Conference, August 19th through the 22nd in Boston, Massachusetts. This is a conference that's formerly known as the MMIS Conference. It is the conference for MMIS professionals, bringing together thought leaders from the public and private sectors to share ideas, to share information, all related to Medicaid systems and initiatives. You can get a link to and all the details about this event at MedicaidTalk.com. Well, let's continue our conversation with Karen Dale about transforming care management. And Karen, before we had to jump out of there, I apologize for jumping in, but it was about to start, and I didn't want it to get on top of you. You were talking about the technology component of helping to increase member engagement. And I know this is on the agenda of many, many Medicaid organizations right now. Tell us a little bit about what that technology component looks like.
Absolutely. We have a number of members that have diabetes in our community, and again, it can be a very complex chronic disease for them to manage. So we wanted to think through what might be an appropriate support and an extension of our care management model. And so in this situation, we want to engage the members sufficiently to lead to them having an annual visit with their primary care provider, ensuring that they're having the appropriate preventive screenings and visits, such as eye exam annually, foot exam. We want them to be adherent to their medication, use the ER only when necessary, make sure they're active, have a good diet, those types of things. And so we've designed an intervention that is two parts. One is that the member receives text messages that help them to just get little nuggets of information on their phone that tell them about these key areas I just mentioned. We also have a second component, which is the community engagement piece, where to further engage the members, because if you're just getting these text messages, after a while they may just not pay attention. So we want to mix things up a bit. There's also a community piece where, for example, a month ago we were in the community and had a nutrition class, or nutrition/cooking class, where we made asparagus soup. What was good about it, though, was it was in the community, and it showed the members how easy it can be to make something that is very healthy, low calorie, doesn't take a lot of time to make, not expensive. So, having that component we think is important. The other piece that we'll be doing in July is an activity component. So we want to be sure, because it's very important to this disease, that members are active and not gaining excessive weight, that they will have a class that's going to be a lot of fun, where they're going to learn about how to stay fit without having to necessarily go to the gym or have a lot of equipment. We also, on the text message side, will be starting pretty soon two-way messaging, which will start off with quizzes. We will send the member a question based on content that they've received in previous text messages, and then they can respond back. And the person or persons that respond back over time with the most correct answers will be entered into a raffle for some kind of health promotion item. So a pretty robust approach in terms of looking at some ways to keep members engaged, but also using technology, which we see from the standpoint of text messaging, being able to, the platform that we're using is a very low-cost platform. It allows us to have full controls, and so it's a solution that we imagine we will scale tremendously over time, so that we can put it in the hands of our full care management team. We can have it be a tool that our providers have that they can use to go back and forth with members. It's fully secure. We have all types of audit trails with it. So we feel as though it's a pretty good solution that can be leveraged further beyond what we're doing right now with diabetes once we finish this portion of the pilot.
Yeah, it requires a lot of touch points, doesn't it?
Yes, it does.
I remember I was at a conference, or I guess it was earlier this year, and one of the health plans was doing a presentation on some of their member initiatives, and the leader of the plan said that one of their members told them, if you need to get a hold of me or you want to tell me something, you need to send me a letter, email me, text me, and then call me on the phone. And then they'll get the message.
Very true.
Yeah, I think it's very true across the board. Which kind of leads me to my next question, because I'm wondering, and I know our audience often wonders this as well when they're hearing how one organization is doing one thing or another. In what way are the member engagement initiatives that you're employing right now, Karen, how are they unique to your Medicaid population?
there's a recognition on our part that healthcare is local. And so we have 8 wards in the District of Columbia, and one of the things we know is that depending on the ward you live in, you can literally see very striking differences in the health outcomes. Where the federal poverty level is lowest, we see much more health disparities. And so we have to take that into account as we think about each member and their unique situation. We know that if you live east of the Anacostia River, you are probably more likely, and on Medicaid, you're probably a bit more likely to have hypertension, diabetes, high cholesterol, and possibly not have a full-service grocery store. So when you add the complexity of having diabetes, where it's so important that you are making healthy food choices, we have to think through how do we support a member to get to that healthy food if there's not a grocery store there, and we have to think outside the box. So in partnership with, for example, one of the hospitals located east of the river, we support on Saturdays a farmer's market. So it's that kind of looking at things in a different way that I believe is unique to what we're doing. We also recognize that health is more than health care, so we've got to look at the whole member and tackle the social issues that affect our members' health. And that's where it becomes so important to have outreach in the community, whether it's a community health worker, whether it's a social worker, whether it's a member that has such intense needs that we have to send a nurse out. We have to meet the member where they are.
A lot of our listeners and our viewers are part of Medicaid MCOs that are in a growth mode right now. They're really expanding into new markets and so forth. So I think it might be interesting to talk about one of your other pillars, and that is provider engagement, because that's a big part of what they're involved with as well. So tell us about, first, just about the provider community itself that you're dealing with.
We have a pretty good provider network, if I do say so myself. It contains about 1,600 professionals, about 80 specialists, and we have all of the hospitals located in the district as part of our network. So it's a very robust network. We do have a number of federally qualified health centers in the city, and what's significant there is that our federally qualified health centers are part of the D.C. Primary Care Association, who has done a tremendous job in getting financial resources to support the FQHCs so that, for example, all the FQHCs have an electronic medical record. And, most of them right now are working on their primary care medical home certification. And so they get this full complement of technical assistance and funds to support them in being absolutely world-class in terms of the delivery system that they provide. And so that's just a great thing that we have in the partnership working with them.
No doubt. It's to have that complete spectrum involved like that, it's got to be a huge advantage that you can leverage.
It is. And so we have taken that advantage and are using it completely to the benefit of our members in terms of changing the conversation about, what our mutual goals are and how do we truly partner to achieve them.
Would you say that level of partnership is unique to your health plan, or is that something you think is going on across the country?
I believe the conversation is starting across the country. There's a recognition that in order to improve the health outcomes of Medicaid members, you have to do things differently. The conversation cannot just be stuck on I want higher rates, but rather how do we change the health outcomes? And with so many states experiencing fiscal pressures, they're becoming very discerning value purchasers. And so providers alone can't do it, and managed care organizations alone can't do it. But we together can absolutely deliver the value that Medicaid is looking for across the country.
Mm-hmm. I think you're right, Karen. We're seeing this to some extent in our client base. We're seeing it, or hearing about it also from other guests. There's a much greater focus today on partnership with providers in a more than just a contractual obligation, more than just a contractual relationship. I think there's a much greater emphasis on that, because it's, just cutting rates is not going to be the answer, and just raising rates is not going to be the answer. There has to be, a greater level of practical application and innovation that goes on, and I think what you're doing is a great example of that. And we're going to pause here for just a few more minutes, and then we're going to come back and finish our conversation with Karen Dale. So please stay with us, and we'll be right back.
I hope you're enjoying today's show, and I want to remind you that opinions and viewpoints expressed by guests on the Medicaid Matters Talk Show are not necessarily those of the host or our sponsors. Thanks for listening, and we'll be back in just a moment.
Every 19 seconds, a child will die because of a lack of clean water. It is estimated that more than 80% of childhood diseases and deaths in underdeveloped countries are a direct result of drinking contaminated water. During the course of this commercial, 3 children will die. You can help make a difference in the lives of these children. By supporting Healing Hands International, you will provide safe, clean drinking water to families and villages around the world. Since 2006, Healing Hands has drilled more than 400 water wells in countries like Haiti, Ethiopia, Zimbabwe, and Honduras. Through the help of people like you, we have been able to bring the gift of clean water to more than 1 million people. To learn more about Healing Hands International and what we are doing to help, visit www.hhi.org. With your help, we can continue this life-saving work and make a significant difference in the lives of children.
This is Medicaid Matters, the only Medicaid business live talk show. We're national and growing. We'd like you to be a part of our Medicaid Talk community. You can go to Facebook.com and find the Medicaid Talk page there and make sure you like it. You'll get all kinds of updates. You can even watch the show right from Facebook as well. We're here every other Tuesday, 1 p.m. Eastern Time, always with interesting and innovative guests like we have today as well. Hey, we just started a new campaign to help raise $40,000 for Healing Hands International before the end of the year. I want you to invite you to join our campaign. Our goal is to bring clean, healthy water to underdeveloped parts of the world. My company, Managed Medicaid Services, has set a goal of building 100 wells around the world in the next 10 years. And you can be a part of this effort by supporting Healing Hands. You can learn more about how to join us in improving the health of tens of thousands of people worldwide by clicking on the Healing Hands logo at the MedicaidTalk.com webpage. If you're there watching us now, why don't you go ahead and take a look and be a part of that effort. I think you'll be very pleased in what you're doing. Well, Karen, let's talk a little bit more about your provider engagement initiative. Tell us a little bit about what that looks like.
One area that has worked very well in terms of provider engagement is sharing with our providers clinically relevant information. It doesn't make sense for the managed care organization to have all this great data based on claims history, and the only thing providers know about is the one thing that they may have done. Many of our members, due to a variety of reasons, are accessing care at the emergency room or at whatever provider most met their need for an appointment. and it may not necessarily be their primary care provider. So we want to share the relevant information with providers as real time as possible so that they have the best information on which to make decisions. So I'll give you a couple of examples of how that works. We have a discharge transition program that we began with one of our hospitals where members that have diabetes, if they have been hospitalized, we outreach to them before they are discharged to make sure that we get them scheduled with a primary care provider appointment and that we provide to the hospital provider complete pharmacy information for that member so that when they are writing the scripts for discharge and trying to think through exactly what is most appropriate for that member, they have the benefit of having as much information as we have to individualize and really make sure the most appropriate plan is developed. We also know that those members that fall into the category that for many plans, they're like the top 5% who are driving maybe up to 40% of the cost, the high-risk, high-cost members,
right,
that their multiple comorbidities can make it very difficult for them to be managed. And a provider may not know necessarily as easily or as early as we would like them to know that's what's going on with that member on their panel. However, we know that, and we're always tracking and trying to do very intensive case management for those members. So for two of our very high-volume providers, one is that FQHC I mentioned and another provider, we share with them our high-utilizing patient profile, which gives them a lot of detailed information about the member and their episodes of care and what's been going on with them. And so we share that information with them for their panel. What this has allowed us to do is to have a very different conversation where we're zooming in on the same members very quickly and talking about how do we now collaborate on the appropriate plan to manage this member. And so it cuts past a lot of the clutter where we're trying to figure something out and they're trying to figure something out. It gives us both the same unique member view that helps us to identify issues or potential barriers or have a great collaborative conversation about where we should be headed with that member. So sharing the pharmacy information and sharing the high-utilizing patient profile information is, a great way that we are engaging our providers by making sure that they have the right information. We're also very pleased that Mary Center, one of our providers, did get one of the CMS Innovation Grants for about $15 million, and what we put forward was a number of these components in that grant that support a fully integrated approach to care management and improving health outcomes. And part of that funding focuses on having a more real-time system, a regional health information network that will give everyone the benefit of knowing exactly what's going on with the member about almost real time. Mm-hmm. So we're very excited about that.
Well, I wish we could, we could almost spend an entire show talking about how to take that data and turn it into information because mm-hmm. it's so important. And if you think about, the three kind of long-term strategies that are going to really impact the cost of Medicaid health care and providing care, increasing quality, certainly of the three things that you can think about, technology has to be at the top there. So there's a lot we could talk about there, but I know you also have done a lot with community engagement. And we have about 6 minutes left in the show, and I didn't want us to get away from that topic and run out of time. So let's talk something about that, because that's something that more and more Medicaid organizations are expanding into right now, and really grabbing a hold of the community resources and bringing the community into it. So first, what is DC Chartered Health Plan doing to increase the community engagement?
I mentioned one portion of the strategy, which is going beyond our walls and embedding more and more of our staff in the community. I mean, ideally, the only people that should be in the building are those that need to be here. Everyone else will be outplaced somewhere in the community. The other piece is recognizing that, again, healthcare is local, and that our local community here is a multilingual, very global community, lots of subpopulations, and health also occurs very much in a cultural context. So we have taken a laser-like focus to addressing each sub-community that's located here. This past Saturday, we did a community event in Adams Morgan, which is a highly Latino community, and we did it in conjunction with Telemundo, which is a Latino station. And so they had several Latino celebrities that were part of the event. What was very wonderful to see was how our providers came and supported us, and we did screening for, most things, diabetes, hypertension, HIV. We also had someone there to do dental screening. And what was wonderful about this as well was that it was all done in a very culturally sensitive, culturally relevant way. So the primary language of the entire program was Spanish. And the volunteers that we had there were Spanish speaking, so that the community really felt that they were embraced and that they were understood and well supported around their health. And we plan to do many more of these events focused on the subpopulations located here in the district, because, again, health occurs in a cultural context, and we know that just because people are living here doesn't mean that they have left behind the culture that they came to this country with that might be influencing their beliefs about health or their health behaviors and practices. So it's really important to us that we understand that. In our practices around hiring, we are definitely focused on getting people that are multilingual, so not just bilingual, but multilingual, and of varying cultures, so that our members feel that we represent who they are.
Sounds like your members have responded very positively to this.
They have. We had probably over 400, close to 500 people at this event, and again, it was a lot of fun. Health cannot be this very dry thing where it's filled with you should. The best way that we're going to get members engaged is to have a mix of health education and support and screening and those kinds of things, but also a healthy dose of making things fun.
No question. Was this something community leaders brought to you, or was this an initiative on the part of the plan?
This was on the part of the plan. We definitely saw a need to be visible in the community, to engage with them, and again, embrace their culture and their perspective, so that they will come to us and view us as an absolute resource for them around all things that they may need related to their health.
Well, Karen, we're out of time. I really had a lot more I wanted to talk to you about. Maybe we can have you come 90
back. Seconds.
That would be my pleasure.
All right, great. Well, that was Karen Dale, Executive Vice President at DC Chartered Health Plan, talking about how they are transforming care management. So much more we could go into with that, and hopefully we can in the future. Yeah, our next show is on July 7th. Our guest will be Michael Richards, Executive Director of Government Relations and External Affairs at Gunderson Lutheran Health System. Our subject, Advanced Directives. You can get more details at MedicaidTalk.com. If you want to get updates about our show, as well as the work we're doing in Medicaid healthcare, be sure to register to get notices from our blog. And you can do that right there at MedicaidTalk.com. You have my personal guarantee you're not going to be inundated with worthless email, but you are going to get relevant and interesting information about what's going on in the business of Medicaid healthcare. Also, remember, we're going to be broadcasting live from the Medicaid Enterprise Systems Conference in August. If you're going to be there, please make plans to stop by and see us at the broadcast booth. You can get all the details at MedicaidTalk.com. Well, you've been listening to Medicaid Matters, brought to you by Managed Medicaid Services. Today is Tuesday, June 26th, 2012. This is your host, Richard Gayton, and I'll be talking Medicaid with you again in 2 weeks. Have a great day.